Welcome to this program on no and minimally invasive veneers. That's what we're going to concentrate on in this program, and I know that really excites a lot of you because this is an area that really can help expand your practice. I always talk about in my lectures something called line extensions. Line extensions is a new service that you can provide to your patients. Certainly, no preparation and minimal preparation veneers falls right into that. Everybody wants veneers. There are so many patients out there that want to improve their smiles and want these smile makeovers. How can they afford it? We'll touch on that in this program. But how do you do it? Because when you tell patients if you got to grind down some teeth for veneers, sometimes they don't want to go ahead with that kind of a process. So this is going to take you into a whole different area of dentistry. Even if you've heard my lectures before on this topic, there is a lot more that's now come down the pike that we can go ahead and provide our patients. So thanks for going ahead with this training here. Your smile tells everybody who you are. They tell everybody who you are. You know, when we go ahead and survey patients, I do a lot of work in both the clinical parts of dentistry and also the practice management parts of dentistry. I speak on both topics fairly equally when I go out and lecture and give courses. And what we find is that so many times the practice management topics are so involved with the clinical, they go back and forth all the time. But we survey patients all the time, and what we find, the number one feature that patients want to improve upon in their face, you know, from chin to forehead, in their face, the number one feature that they want to improve upon is smile, smile, smile every single time. You know, I treat a lot of patients for Botox and dermal fillers and improving the entire facial aesthetics. But here, it's smile, smile, smile. That still beats the eyes and the ears and the nose and the cheeks and everything else. They're interested in a lot of the other stuff too, but certainly smile, smile, smile. You know these famous people. Would these people be nearly as famous if they looked like this? Certainly not. I mean, you wouldn't even look at them twice, would you? I mean, you know, it's so funny. People even coming in asking for the Julia Roberts smile, but they wouldn't if she looked like this. And Brad Pitt, you wouldn't even give him a second thought. It's smile, smile, smile. That's the number one feature that people look at first when it comes to people's faces and that patients want to improve. So, if nothing else from this course you take away, I want you to take away this slide. I want you to learn how to stop treating teeth and start treating smiles. There's a huge difference between teeth and a smile. And I always ask this question to live audiences. I always ask them, do you want to go ahead, do your patients want great looking teeth? And everyone says yes. And I always tell them no. What they want is a great looking smile. They want that broad Cossack smile. Like I said, they come in asking for Julia Roberts' smile. She must have 1,000 teeth in her head. They want the smile that goes from ear to ear. Now, we've been trained to treat teeth. You know, patient comes in and we talk about tooth number 1, 2, 6 to 11, which a lot of dentists think is the smile teeth. Not true at all. How many teeth do people show? How many teeth do you show or your team members show when they smile? I would bet 6 is the absolute minimum. It's usually 8 or 10 teeth when you really start to look at people about that and they go into a broad smile. Take a look at your own smile when you go ahead and get to a mirror. What I want to do is go ahead and change your vernacular. Get rid of the word teeth when you're talking to patients about facial aesthetics and teeth aesthetics, and put the word in smile. Okay, when you make that little change, all of a sudden people start thinking about bigger cases and they want to improve their smile. I know what happens in your office because the same thing happens in my office. In my office, people come in and they just want to go ahead and change these 2 front teeth. Can you put veneers on these 2 front teeth, doctor? I get that question all the time. And what I tell patients is this, you know, Mrs. Jones, I know exactly what you're looking for. You're really looking for a great-looking smile. And of course, that's what she agrees to, because that is exactly what she's looking for. We then give them a mirror, and we say, let's count up how many teeth make up that smile. All of a sudden, they start thinking, wow, it's much more than just these 2 teeth. It's going to be a lot more than that. And a lot of times, it's 6, 8, 10 teeth. Now, I don't want to mislead you. You know, I don't want you to think that every case I do in veneers is 10 teeth long or 20 teeth. It's not like that at all in my office. I'm in Cleveland, Ohio. And certainly, we've got our challenges there too. But we start patients thinking about the bigger cases. And I always tell them when they want 2 teeth or 4 teeth to save your money. And once they start thinking along lines that they really want a great-looking smile and not great-looking teeth, because that's what they get if they just did the 2 teeth. By the way, the 2-tooth case, do you like doing those? I don't like doing those. That is such a loser case. You know that. I know that. Why is that? Because what color does she want these two front teeth? What color? White. The rest of her teeth are shade D4, or they're gray, or who knows what they are. You're going to have these 2 big beams that will be shining out of her mouth every time she smiles. She's going to look like Bugs Bunny. She's going to hate the result. She's going to hate you for doing it. That's not where you want to be. With the minimum amount of teeth that we'll do when we go ahead and start rebuilding a smile or doing a smile makeover is usually 4, with the understanding from the patient that we're then going ahead and think about the next 4 within the year. Once we place that initial 4, boy, they're usually back a lot sooner than a year later. They're usually back in a few months once they see what a real smile can start to look like. Now, let's dive right into veneer preparation, because that's going to be important. There are really 4 different kinds of veneer preparation. The first one, no preparation. I'm going to define that in this program, I'm going to define that as I'm not touching the tooth at all. That's exactly how I'm going to define it as. Interestingly enough, when you see a lot of these articles about no preparation, many times, to me, sometimes they're almost a full preparation. They say, well, we're doing no prep except we're removing a lot of the enamel here, and then we're getting into dentin there. When I talk about no prep, I mean I am not touching the tooth with a burr. I may use a soft, some kind of a contouring disc to take off any sharp angles around an incisal, because porcelain hates a sharp angle, and that can be a fracture line, but I'm not touching the tooth with a burr. Minimal prep, I'm going to define that as enameloplasty, which means cosmetic contouring only in enamel. That's probably where I'm at most of the time when I'm doing these cases. The patient advantages, they don't have to get numb, there's no temporaries involved. Most of the time, if you've been around in dentistry as long as I have, you will find, we used to do this a lot years ago. It was called cosmetic contouring. Cosmetic contouring was just in enamel. It was just to make the teeth look better. And a lot of times when you're doing a little bit of this minimal preparation for these veneers, you are going to go ahead and see after you've done the preparation, the teeth actually look better all by itself. And we used to do this as its own technique many years ago. Now people want whiter teeth, and they want everything else that goes along with that. So that has been a pretty good range for us. Minimal preparation, to me, is only in enamel. And it's not automatically taken off an incisal or going through the interproximal. It's only an enamel, only line angles, and that's what we're going to concentrate on in this program primarily. Limited preparation, that starts to get into some dentin, and that starts to get to automatically taking off the incisal edge. That's going to be a limited preparation. Some of it's in enamel, some of it's in dentin, and then certainly what many of you are familiar with is the full preparation veneers. Let's be honest, that probably shouldn't even be called a veneer. It's probably much more like a 3/4 crown. When you take off all the facial enamel and you cut through the interproximal contacts, pretty much wherever you went to dental school, that's called a 3/4 crown. And that's where automatic, it's the incisal off. Automatic, we're taking off most of the enamel, if not all of it, on the facial surface and creating a big chamfer margin all the way around the tooth. That's not where I'm at most of the time. You will see, especially with the new veneers that have now come into dentistry from some of the great laboratories that do a lot in terms of aesthetics, you will now find you can get the same, if not a better result with no or minimal prep veneers than you could even if you went to a full preparation. Now, this doesn't mean that I'm against full preparation or I'm only for no prep or I'm against no prep. It's not about that at all. That's not what I'm about. That's certainly not what this program is about. It's about having the right preparation for the right patient, for the right diagnosis and treatment plan, and for the right tooth. That's what it's about. You should learn and know all these veneer types, because many times the combination cases that I have, some of which you'll see in this program, will be full preparation, even a full crown on some teeth, and then you've got to match them to no prep veneers. And we'll show you a little bit of how to do that. So it's not at all about what's right or what's wrong. There is no right or wrong. When patients come in, they each have individual needs. Every tooth you'll see is going to have its own individual needs. On the same patient, I may have 3 no prep, 3 minimal prep, and 2 or 3 full prep. It really depends what the situation is. So let's get to some of those situations. There are lots of reasons to prepare teeth for veneers. Lots of reasons. And again, it's what the patient comes in with that really determines it. Severely prominent teeth. Teeth that are really bucked out, that you've got to do some preparation. Severely discolored or dark teeth. Many times you will see that teeth may not be as discolored as you may think so, but certainly there are cases where patients come in with very dark teeth. Well, then you better do some preparation, or you may even need to put an all-porcelain crown on it or something else like that. You need to determine that depending on the patient and on the case. Poor arch contour. Teeth that are in and out of the arch form, you will see all the time. Something that is really bucked out, rotated, twisted, that needs to be prepared, no matter how you do it. No preparation, minimal preparation is not magic. You've got to have the right circumstances, or you've got to be able to create the right circumstances, as we are soon going to show you. Misaligned teeth, rotated teeth. When the lab uses the wrong porcelain, this is probably the #1 reason why most dentists have unsuccessfully done no prep or minimal prep veneers. The lab is using the wrong porcelain. Most laboratories, when they want to go ahead into this area of no prep veneers, are going to use the same crown and bridge porcelain that they use everywhere else. Well, those crown and bridge porcelains typically are a little bit of a larger particle porcelain. They can't make it thin. We're talking about thin veneers of 0.3 to 0.5 millimeters. That's a really thin veneer. If they try to go ahead and use the wrong porcelain, it's going to come out way too bulky and way too opaque. Indeed, that is one of the biggest complaints about no preparation veneers in the past, no matter who's made them, is they're too bulky and they're too opaque. This may be one of the reasons your laboratory is using the wrong porcelain. Okay, so that is generally what we are looking at in terms of there are reasons to prep, but I'm not going ahead and prep a patient because my laboratory is using the wrong porcelain. And I want to make this point very strongly. I really want to make this point very strongly. I'm in business to treat the patient. What I need to do is about what's best for the patient, not what's best for the laboratory. When the laboratory goes ahead many times and they send you back a case and they say, you didn't prep enough, prep more, you're really prepping for who? The laboratory. I'm not in business to make the laboratory guy happy. He's not the one paying me, and he's not my patient. And if you know anything about dental materials, and the first lesson that we learn in dentistry is do no harm. Dental materials should be there to serve the patient, not go ahead and harm the patient. So if I've got to re-prep a case because they're using the wrong porcelain, something is wrong in that whole equation. So the big secret to no prep veneers, I'll give you a little bit of what the big secret is right now. 2 secrets. #1, they are bonded to enamel, and #2, your laboratory has to use a specialized porcelain made for this technique. Something that is strong enough and thin enough that can be made as thin as 0.3 millimeters. That's the option. It can go as thick as, on the same case, 2 millimeters, or even on the same tooth. It doesn't make really a difference, but it can be made as thin as 0.3 millimeters and be strong enough to get to the mouth. That eliminates a lot of the porcelains that are currently on the international market. So these have got to be specialized porcelains made for this special technique. So that's crucial. If your lab is using the wrong porcelain, then it'll be too bulky, too opaque. It'll look terrible to you and the patient. No one will be happy. You've really got to use the right porcelain. I can't make that point strongly enough. Now, reasons not to prepare teeth. And there are lots of reasons not to prepare teeth. First of all, patient acceptance. Wow, if you can do this, a lot more patients go ahead with treatment. Patient comes into you and they've never had a filling. And they come in for veneers, they want to look better, they want a smile makeover, they saw an ad somewhere, and they come in and they sit down and you tell them, well, you know, we really got to really get you numb and prepare all these teeth and really start sacrificing some tooth structure. They think, gosh, I've never had a filling. You know, I don't want to get into this kind of thing, and they leave your office. You need to do no prep veneers because that will really open a lot more patients to your office and to your production. Ease and comfort for the patient. That's what we're all about. Strength, bonded to enamel. Nothing is stronger than bonded to enamel. And I know, I've been a clinician's report, a CRA evaluator. Everyone knows Gordon Christensen's group. I've been one of their evaluators for a long time. And I know their scientists and a lot of the other scientists come and they say, these bonding agents are just as strong to dentin as they are to enamel. You know that's not true. I know that's not true. It doesn't happen like that in my office. Have you ever taken off a dentin-bonded veneer? Sure you have. How do you take it off? You score it, you get underneath it, and you pop it off. That's dentin bonding. That doesn't mean it's not strong. It's strong, but it's not as strong as enamel bonding. You put on an enamel bonded veneer, try cutting one of those babies off. How are you going to cut that off? you're going to grind and grind and grind until you get the tooth structure. There's no way you're ever going to pop it off. There's your difference between enamel and dentin bonding, pretty simply. They both work, and they both work great, but enamel is always going to be much stronger than that. So enamel bonding and using the right porcelain, those are the two big keys and the two secrets to getting these things to work. Longevity, they're bonded to enamel. 20-year studies on a lot of these no prep veneers that are out there. No anesthetic, no temporaries. This is probably the biggest advantage in my office and for my patients, and certainly for a lot of dentists, and the reason that they got into this. No temporaries. I hate making those 3/4 crown temporaries. So do you. Why is that? They're hard to make. They take a long time. And how do you keep them in the mouth? I know, I've tried, you've tried. How do you keep them in the mouth? Well, you can bond them in the mouth. You can do some spot etching and bonding. But if you bond them in the mouth, then what happens? You can't get them off, or you'll break off some tooth when you do take them off. If you don't bond them in the mouth, what happens? They fall off. The most miserable 2 weeks you ever spend with a patient is when they are in these 3/4 crown / veneer temporaries. I hate them, and you hate them too. With these techniques, we don't use them most of the time. Sure, there are some times when we've got to make one, or if there's a crown involved, we've got to make some temporaries, but these are not like crown temporaries. Crown temporaries pretty much stay put for a long time. No temporaries is a huge, huge advantage. The reason being is it saves time and it saves aggravation, and we don't need them. People walk out of my office after a minimal prep veneer, and what happens? They look a little bit different, but not radically different. They're comfortable. They may be a little more sensitive than they were before, depending on the situation, or maybe they didn't have any sensitivity before. Now there might be areas that might be a little sensitive. We usually will put a little bonding agent over that for the meantime, but generally that's not even the issue. But there's no temporaries. That saves a lot of time, a lot of effort, and the patient's happy because they don't have to deal with the acrylic in their mouth or any kind of temporary situation in their mouth. Lab using the right porcelain. If you haven't gotten the message so far, get the message. If your lab has not developed a specific porcelain for this technique, you're probably not going to have great success, whether it's clinical or whether it's an aesthetic success. So that is really, really crucial here. Let's see who's come into this whole arena. You know, no question this thing was started by the Demnac company with the success of Lumineers many years ago. I mean, that really all of a sudden came in this whole arena, and they were saying no preparation. And, you know, there's no question that sometimes things were a little overblown when all these no preparation veneers really started coming to the market, because many times you do need some minimal preparation. But the concepts are all good concepts there, but maybe abused by a lot of dentists that were out there, and that kind of gave some of it a bad name. But certainly people thought no preparation is never going to work. Now you've got all these other laboratories that have come in. It's hard now to even find a lab that doesn't do some kind of a no prep or minimal prep veneer case and have some kind of a product out there. The difference is most of the laboratories are going to use their regular porcelain. And indeed, that really is not appropriate for these situations. And the way you can really tell this many times is if your laboratory says, yeah, no prep, this is our no prep veneer, put them on, but don't you dare finish the margins. And there are a couple on this list that say that. They tell you in their trainings and in their DVDs, you cannot finish the margins, which means you're going to have this little shoulder, and we'll tell you how to take care of that little shoulder. You'll have a little shoulder in your end result. What will happen then? You'll have these beautiful veneers, but you'll have these big red gums. See, the laboratory is not liable for that. You, the dentist, is liable for that. When a patient leaves my office, they've got to have the proper margins, the proper emergence form, all those things that I've got to create and I'm responsible for. So, you know, the laboratory's kind of out of it. That's not a situation that you want to get into. I want you to take a look at the top name on this list, and that is Crystal Veneers by Aurum Ceramic. And Aurum Ceramic is probably one of the best kept secrets in dentistry. That's what I always call them, because they are a big aesthetic laboratory that you probably have never heard of, unless you've been to LVI. Everybody agrees that the LVI type aesthetics is superior. I mean, it is really high quality aesthetics. Well, Aurum Ceramics is one of the laboratories that helped them get there. They've developed a specialized porcelain just for this technique, and it's called Crystal Veneers. That's the porcelain that is in Crystal Veneers. They can make it as thin as 0.3 millimeters, and all of a sudden what that means is the thinner they can make it, and it's strong enough to get to the mouth, and it's beautiful because they are a very high aesthetic laboratory, and it's beautiful. That's the key. It's not too opaque. It's not too bulky. What that means is that you have to do much less preparation. That's the whole key to all this no prep and minimal prep. The thinner they can make it, the less preparation that you have to do. And that's the proper way to deal with dental materials. And they have brought a whole new level of aesthetics to this entire market, because that has been the main complaint of dentists. Not patients so much, but you would get the patient complaints too. They look too opaque. I don't like the way they look. All of a sudden my cuspids are popping out of my head with some of these other systems, the more common systems in no prep veneers. Not here. They really know how to do a beautiful job aesthetically, and they've got the right porcelain. Again, I can't make that point strong enough for that. So that's what we're using now, and that's where we're going to concentrate some of this program there as well. Here are some of the requirements. I mean, this always gets me. I'm not going to name the laboratories, but I always get, I evaluate all these laboratories for no prep and minimal prep veneers. What you're seeing here are some of the reduction requirements for these that the laboratories want. For their no prep veneers, I mean, you got to be kidding me. 0.7 to 1, 1.5 to 2 millimeters for a no prep veneer. I'm not exactly sure how that works. That's not coming from Orm Ceramics. It's coming from a lot of these other laboratories that are saying, we've got a no prep veneer, but you got to reduce a lot of the tooth. I mean, a 2 millimeter reduction is a crown. Okay, you want to work with a laboratory that really understands these concepts and has the right porcelain to make this entire concept work. What you're seeing here is really the profitability of no and minimal prep veneers. With the traditional technique, when you've got to do a lot of reduction on teeth, and you do it automatically whether the tooth really needs it or not. Again, that's the way it's taught in a lot of places. Your first appointment for even 6 veneers can be 3 or 4 hours long. Okay, not with a no prep or minimal prep orientation. That first appointment can be 20 minutes, half an hour. I mean, how long does it take you to do a little enamel contouring and then an impression? And if it's a totally no prep case, it's just a matter of doing an impression. Second appointment, you save a lot of time. Why? There's no anesthetic. I haven't gotten the patient numb for the preparation. I certainly don't have to get them numb for the seating appointment. There's no anesthetic. I don't have to take off provisionals. Just that alone can be about 45 minutes, and you haven't even gotten started yet. Here, patient comes in, they're comfortable, don't have to get them numb, no provisionals, no temporaries to worry about, and we can get straight to the technique. So your time involvement when it comes to this is really incredibly less. I speak a lot on overhead control. One of the things I speak about is efficiency. You've got a 4, 6, 8, 10 unit no or minimal prep case. Boy, you're doing it in at least half the time that you would do a traditional case. And many times it's what's appropriate for the patient, and many times it's better for the patient. And the key here is on the bottom of these slides. There's no postoperative sensitivity. One of the worst things I would feel is when I would get from a phone call from the patient that's had some of these traditional veneers after I put them on, and they say, yeah, the teeth are beautiful. I can't eat with them. They're too hot. They're too cold. They may have needed an occasional endo here or there. Not so with no or minimal prep veneers. Why? It's all still in enamel. There's no post-op sensitivity. That's a huge advantage. It's great to give people great-looking teeth, but I want to make sure that they're also comfortable and get a great aesthetic result there as well. So here's your best-kept secret in dentistry. They came out. I've been working with them for quite a while now. These crystal veneers. These folks really know aesthetics, and they've really brought it into the no preparation veneer market, and now we are getting the results. It's taken no prep and minimal prep veneers to an entirely different aesthetic level. Now, I want to be satisfied with the result. I know the patient will be satisfied, and they've been satisfied with some of the adequate aesthetics that have come out of some of these laboratories, but I, the dentist, want to feel good about this too, don't I? Sure, you do too. And sometimes we've been disappointed. We didn't say anything because if the patient's happy, then that's pretty much happy. But if we can all be happy and then we get excited about the case there too, then the patient loves it even more. So they brought a whole new level of aesthetics. Certainly it's a very high level of aesthetics to this, and the veneer is called crystal veneers, C-R-I-S-T-A-L, crystal veneers by Orm Ceramics, that they can make as thin as 0.3 millimeters, as thick as what you want. And you'll see different cases, as I'll show you, that have got thin and thick veneers. They're all crystal veneers, and they do a magnificent job, especially with your combination cases there as well. Now, here's a paradigm shift that I really want you to make, though, too, because I know what a lot of dentists think when it comes to no prep or minimal prep veneers. Even if you make the thinnest veneer that you can, 0.3 millimeters thin, then what happens? You're going to apply it to the outside of the mouth, of the tooth, and it's going to feel what to the patient? Bulky, right? It's going to feel a little different because we are indeed adding a minimal bulk and thickness to the outside of these veneers. So let me put you through this scenario in your own minds. You've all had patients probably in the last week where this has happened. You're putting in some anterior crowns, full crown preparations, anterior crowns. It can be 1 tooth, 2 teeth, it can be 6 teeth, doesn't make a difference. And first appointment, you go ahead and prepare the teeth, take an impression, make temporaries, patient leaves your office. Do they really complain about the temporaries all that much? Not really. Why is that? They're numb when they leave your office. They know they're temporaries. As they're coming unnumb and the numbness is wearing off, then what's happened is their musculature has already adapted to some of these veneers, and they know they're temporary, so it's no big deal. You now go ahead, 2 weeks later, to put in the final crowns. Okay, anterior, full reduction, anterior crowns. You go ahead and put them in, and you've worked with your laboratory, and the buccal lingual is perfect in size and length. Everything is perfect. You put this in, what's the first thing that most patients say when they get a full anterior crown? How does it feel to them? You know, you hear it all the time. Hey, this feels bulky. This feels big, is probably what they say. Now, what they really mean is it feels different, right? It's different than the temporary, and they can feel the difference with their lips. It feels different. What do you tell them? You'll get used to it. And what happens? They get used to it. We know, and there are studies going back to the 50s that show this, that you can change the buccal lingual of a tooth to a patient's musculature probably up to 0.5 millimeter, maybe even a little bit more than that, and the patient can get used to it. That is exactly the scenario that's happening here. If you can keep it very thin, you don't have to do a lot of preparation, and it's thin enough, most patients can get used to it, and it won't feel big or bulky at all, especially when you pick the right situations here. So let's go through that. And here is a patient that really fits this scenario. And here's some of the takeaway I want you to get from this. This patient comes in, and let me show you on the screen. This patient comes in, and they have had 6 units of veneers. They've gone from tooth number 6 to tooth number 11. They've had 6 units of 3/4 crown / veneer preps. And they're beautiful veneer preps, by the way. But they only did from number 6 to 11. For some reason, many dentists, and by the way, this patient is a dentist, many dentists and many patients think that the smile teeth are cuspid to cuspid. You couldn't be more wrong. Most patients show at least 8 teeth, and some go to 10 or 12 teeth. But he initially got some veneers from number 6 to 11. And these are full preparation. These were done in the year 2000, and they were probably shade A2 when he first came in to see me. He now wanted white veneers because all of a sudden everybody's getting white veneers. And he wants to show his patients what white veneers can look like. And he's also getting married in a few weeks. So he wants to extend it to go from tooth number 4 all the way over to tooth number 13. But right here, it gives us the opportunity to show the difference between minimal prep and full prep veneers. And then you decide for yourself what the aesthetics are going to look like here. So here you go. Right in the middle here, right there is the dividing line. Did I have to get them numb for these? You bet. I had to get them numb for those, take off the old veneers. And did I have to make them temporaries for these? You bet. I had to make them temporaries for those. How about these over here? If you look closely, you can see these little lines that were created from a burr. These were out a little bit too buccal, and some lines created from the burr. And minimal reduction. Did I have to get them numb for these? No way. Did I have to make temporaries for those? Certainly not. So right here is the dividing line of what you're going to see. Now think about this with me. These are going to be 0.3 millimeter crystal veneers. These are going to be your traditional 1.5, 2 millimeter crystal veneers, right? They're, it's the same case. It's going to be this combination case here. And this is the laboratory's job to make it all come together. The ceramists at Orem Ceramics really knows their crystal porcelain. They really know it. They know how to adjust the opacities so that when it comes to me, I use one color cement and I am going to cement everything. I could adjust it if I need to, but generally they are so good, one color of cement, and I can go ahead and cement everything at one time. And here is the next slide here as well, where you can see, here's that dividing line again. These were the preps. These were not the preps. These were the minimal preps here, there as well. I had to make them temporaries. I had to get the anesthetic. I had to take these off at the seat appointment. But look, they've all the same color. These are 0.3 millimeter veneers, and these are 1.5 to 2 millimeter veneers. See, you, the dentist, should not be that worried about. This takes a very, very talented laboratory to be able to do that. And that's the kind of aesthetics and result that you can see that you can get with this crystal veneer porcelain. You couldn't get this with a lot of systems. A lot of systems that are out there, even some of the initial ones, really had trouble with these combination cases, and you had to do a lot of color changes and really have to play with the color. These, that doesn't mean you won't have to do it here on occasion either, but they are very talented. But just look at the texture that's in these teeth. Look at the texture that's in these teeth. So many of the no-prep veneers done in the past, they look flat. They just look dead looking. They were way too opaque, and that's why they didn't look that good. These are really much more lifelike. Now, in my pictures, I don't see this patient again. He lives 6 hours from me, and again, he's a dentist, and he traveled quite a bit to get to me. You'll see these red gums. I don't get to take on some of these patients the pretty pictures a few weeks later. I would rather do the proper finishing and show you red gums now than have the patient live with red gums forever. So you'll see that in a few of my cases through this program here as well. Case selection for the no prep and minimal preparation case. This is crucial. This is crucial. So take a look at this list, and if these situations are in the mouth, if they are in the mouth, and this is the way the teeth are, then you've got, if all of these are exactly what I describe here, then you've got a perfect case for no prep veneers. You may not even have to pick up a burr. But if anything is a little bit different from this, then you may have to go to some minimal preparation. Certainly if it's very different from this, then you may have to go to a full preparation veneer or even a full crown. So let's go through these one by one. Buccolingual inclination of the teeth. If the teeth from the side are straight up and down, and that's what they look like. If they're straight up and down, sure, you don't have to do any preparation because you've got room to place 0.3 millimeters or maybe even a little bit more for veneers. Or if it's lingually verted like this, then you've got lots of room. You don't have to prepare a tooth that's lingually verted. If the tooth is tipped out buccally or it's moved out buccally, then you may have to do some preparation. We try to stay in minimal preparation. We purposely don't get patients numb because a lot of times we're surprised. We'll start a minimal preparation on the tooth, just an enamel, and we think that we may have to get through the dentin. If the patient starts getting sensitive, then I'll get them numb. But many times I'm even surprised myself where I can do a lot of minimal preparation, and what happens is, I've gone much further than I thought I could. Patient's still very comfortable. There's still a lot of enamel. So I always start these preparations off with no anesthetic, even if I think that I may have to get into a preparation situation and into dentin later. But your buccolingual inclination is really key. Always take a look at the teeth from the side, and that will give you a good indication as to where you are. Position of teeth in the arch form. Nice arch form, maybe left by orthodontics or naturally. Great. You probably don't have to touch those teeth for any kind of preparation. If teeth are in and out of the arch form, then you have got to go ahead and perhaps do some modification and get into a minimal prep. If it's really out of the arch form, twisted, rotated, you may have to go into a full prep situation. Diastemas and spaces are good things. These are good things. These are natural spaces that are created, or they may not be natural spaces, but for some reason there are spaces between the teeth. That leaves you room for the porcelain. In those cases where all of these spaces are pretty natural and pretty even, that's a perfect case for no prep veneers. What I never understood is why would you prep a tooth that's got a diastema? It's already got too much space. Why would you go ahead and need to create more space? You really don't in many situations. The whiter the teeth are to begin with, the better the result, no question about that. We will bleach most patients before we put veneers on them because we're going to start with a nice white base and that will translate through the veneer. Occlusion is certainly the key to any successful case. No prep veneers in the past, and people, have told me, well, you're just slapping porcelain onto teeth with no regard to the occlusion or anything else. You couldn't be further from the truth. I mean, occlusion is the key to any successful case in dentistry. Occlusion can make you or break you. Certainly here as well, occlusion is the key. And we're going to go to whatever occlusive philosophy that you go ahead and subscribe to. That's how you should be finishing these cases. And it's easier here because once you're bonded to enamel, it's actually much easier to go ahead and finish these things because I'm not worried. I know when I'm bonded to enamel, that is a very intimate bond. Indeed, it's just like tooth structure according to many studies that are out there here. And here is some kind of an indication for you, cosmetic contouring. This is what we're looking for in terms of cosmetic contouring. And you've got these sharp angles, these sharp line angles on teeth. that is what you're going to remove. If a tooth is too long, then certainly you're going to go ahead and adjust this as well. But this is really very minimal. I don't have to get a patient number for this. And this is what it's going to look like after. If you compare this view to this view, especially around the cuspids, it just looks much softer. It's a softer look. And it's going to leave me, I don't want any sharp line angles, that's for sure. I want to give the laboratory some nice contours to work with so they don't over-contour these teeth and they don't come out too bulky, and certainly we worry about them being too opaque as well. So you've got to give them a little bit of leeway. We get rid of all the sharp line angles on teeth. This preparation, as you see in this slide, how long do you think that took? That doesn't take more than just a couple of minutes to go ahead and get this done. Arch form is really, really important. The arch form is incredibly important here. What you're seeing is we are looking for the teeth that are kind of falling outside the arch form. We'll flatten many of the buccal of many cuspids here. As you come across here, we're going to catch this line angle on the mesial here. As you come across, there might be a little bit of bulk that we're going to take across. We're just going to improve this arch form. We don't have to make the arch form perfect. But if we can just improve that arch form a little bit, that gives the laboratory a little bit more leeway. You will have a much nicer result. Automatically, I almost always will go ahead and flatten these cuspids because many times that is an area where you have lots of enamel. We want to shave them down a little bit. I'm not a big fan of big, bulky cuspids. Some people are. If that's what you want, the laboratory certainly can make whatever you want in the crystal veneers. I'm not a big fan. I think people like a little less contour in some of these cuspids that are out there. Let me just show you in terms of the contouring itself. What we want to use are finishing diamonds and discs. We don't want to use this big coarse diamond, not at all. I know if I put a big coarse diamond into any dentist's hands, before you blink, you'll have a full preparation and maybe even a crown, maybe even get straight to the pulp before you even swallow, for crying out loud. We don't want to do that. We want to go ahead and only go ahead and use a finishing type diamond. This gives you much more control. You'll stay in enamel, and indeed, you don't need a lot of reduction in many of these cases if you've chosen the case properly. So we want to give you some more control. Finishing diamonds will let you shave them, and I also use finishing diamonds as opposed to finishing carbides. The reason being is that carbides still tend to cause a little bit of a chatter. Don't forget, my patient's not numb here. So what I want to go ahead and do is make it as comfortable of an experience as possible. So I'll use a finishing diamond, and then once you're done with whatever contouring you are doing, you want to go back with some discs, take away any unsupported enamel and any little enamel tags that are around there. Porcelain hates a sharp edge or a sharp margin, and it will break. That can become a stress point and a fracture point no matter what the porcelain is. So we want to make sure things are nice and smooth. Let me show you some of the other things that we're going to deal with when we're going to do these crystal veneers. And one thing you obviously need is a great cement. The cement that we use most of the time is going to be Veneer Veneer. This is a great microfill resin cement that will give you a good range of colors where you'll be able to change things a little bit if you need to. And it's really up to you whether or not you really need to do this. And the way they have it is with value shades. Look what they've done here with Veneer Veneer and this shading system. They have value shades here, and it's really a fairly unique system here. What you see here is the medium value shade, and this medium value shade pretty much is a translucent or clear cement. You're happy with the color of the porcelain, you're happy with the color of the tooth, then all of a sudden all you need is a clear cement here. But they also have a high value shades. That's going to make them brighter and whiter. And if you need warmer colors, then to decrease the value, then they have a decreased value shade system. So take a look at this. This is pretty much our cement of choice. Generally where we're at is we are going to be in the medium value and in the high value areas because people are wanting whiter, brighter teeth. I think we've backed off a little bit from these super bright white teeth. And it just seems to me that people have kind of taken a step back. People still want white teeth, but they want them a little bit more natural looking. They don't want the A2s as a natural looking. B1 is probably the base of where we start when we do veneers. B0, 0, 0, 3, 0, 0, 2, 0. The 0, 1, 0s, even the laboratories tell me they're not doing them as much as they were doing them in the past here. So again, this shade system has got a lot of different shades available for you that can increase and decrease the brightness and the whiteness as necessary. Indeed, go ahead and take some of the modules here on guide that we did on our patient for crystal veneers. We did a no prep and minimal prep case for crystal veneers. One of the things she talked about going into it was, I don't want these, super bright teeth. I want them white, but I want more of a natural white. And you see the result that we got. I mean, that case really came out great. And if you want more training on this, and I certainly tell everyone you need as much training as possible in the no prep arena, certainly go to guide and go take the modules that we have prepared here as well. Take a look here. This is one of the keys in doing these cases. And this is what you'll see on the finishing on the case that we did for guide right here. This is really, really key. When you go ahead and, because we have not prepped any kind of a chamfer margin or any kind of a margin, when you go ahead and place a no prep veneer on the tooth, there will be a little shoulder at the edge. There will be a little hump there. And you've got to get rid of that little shoulder. If you don't get rid of that shoulder, then what will happen? The patient will have beautiful white teeth, but big red gums, because it'll be a food trap for the patient going forward here. So you can see, as we describe here graphically, you've got this little shoulder. That has got to come off, and we take some kind of a finishing diamond, and then what happens, you should go ahead and put this right into the enamel, which means you make it smooth right into the enamel, so when you come across the tooth, you will not feel a margin there at all. If you do feel a margin or a shoulder, what should you do? You should go ahead and finish it down. You don't want to leave any kind of a margin. This is exactly what I'm talking about with having a specialized porcelain. You cannot do this with every porcelain. And indeed, some of the laboratories out there that do no prep veneers tell you, don't you dare finish these margins, because they tell you if you go ahead into this area here, then what's going to happen? You'll break and chip the porcelain. And that's the last place you want to go ahead and break and chip the porcelain, because then you've got a rough margin and then again, another food trap. Well, then they're using the wrong porcelain. Orem Ceramics, this crystal porcelain, was developed for this entire no prep technique and minimal prep technique. And it's been really brought us the aesthetics we need, but you as the dentist have got to go ahead and do this and finish this. And this tells it all. What we are doing here, this is what I want you to think about. We are really kind of marginating this after the fact. We're not preparing a margin beforehand. If I did, I'd have to get them numb. I'd probably have to make some kind of a temporary. And I don't want, if you go ahead and put a chamfer in there, some dentists like to do that. If you like to do that and you're successful, by all means, continue to do that. But here, I don't want to do that, because that's the most sensitive part of the tooth. And I'd have to get them numb. I'd have to make a temporary. What I'm going to do here is I'm going to make a margin after the fact. Once I seat that veneer, I'll have that little shoulder, and then I'm going to take a fine diamond or even a 7901 carbide and go ahead and remove that shoulder and blend it. That's probably the best word I could use to describe it, because you're bonded into enamel most of the time. You're going to blend this right into the tooth structure, so when you go ahead and take an Explorer, you should not feel any kind of a catch or a ledge or a shoulder there. This is critical in the success of these crystal veneer cases, and it's something you need to take the time to actually go ahead and do. Let me now show you some cases here, and this case is probably a near perfect case for total no prep. She's straight up and down, and she's got some minimal spaces between the teeth. Perfect. Arch form is great. Everything is perfect. All you have to do is take an impression. This is probably about 15% of my cases, and these are the veneers. I mean, and that's a beautiful result. And the truth of the matter is, this is a beautiful patient. She came in. She's gone to different dentists. She's wanted teeth ground. They've wanted to grind down her teeth. She's barely had a filling in her life. This is a great alternative, and you can get some beautiful aesthetics for these cases here as well. Again, most of the time I am doing some kind of minimal preparation, cosmetic contouring in enamel only, and that is going to work out quite well. Let me show you this patient here. And she is a great patient, has always wanted veneers, and she's actually a hygienist. You can see her gown. She's a hygienist. And she runs over to my office. She wants some veneers, but every dentist wants to grind down her teeth. And she doesn't want to have them ground down because she believes in minimally invasive, especially now that it's in her own teeth there. You can see a close-up view. And what you are viewing is you've got a little bit of a bulky cuspid here. And you've got this tooth, which is bucked out a little bit. It's turned towards the mesial and certainly going to need some kind of preparation. These two central incisors, they're probably lingually everted just a little bit. You've got some bulk here on the cuspid here, and she wants to go back about 8 or 10 units there as well. Here's her after the preparation. It doesn't look a whole lot different, does it? Not really. But look closely and you can see these cuspids especially. They are much flatter than they were before. Even these bicuspids were taken in. You can see how this line angle has kind of been shaved, so it kind of comes a little bit more into the arch form. We could not create a perfect arch form for her because she wasn't even close to a perfect one, but we could create enough of an arch form so that Aurum Ceramics could do a great job with their crystal veneers. And here's her retracted view of before. This is before I did anything on her at all. We shaved that off. We took this in. We shaved this off just a little bit. No anesthetic, no temporaries, didn't need any of that stuff. And she walked around for 2 weeks without anything. You know, the nice thing about these cases, there's no great hurry. They're in a hurry because they want to get them in their mouth. But we're not in a hurry simply because, you know, there's no temporaries I have to worry about and nothing is going to come off. And that's her Aurum Ceramic crystal veneers afterwards. Now, you could never have imagined that you were going to get them this straight with her arch form as it is. But again, think about this with me. These here are probably about 1 to 1.5 millimeters thick in terms of the crystal veneers. Why? Because the teeth were a little bit lingually everted. This is probably a 0.3 millimeter veneer. And again, this is right at the finishing appointment. Look at the cuspids and how nice and natural they are there. Look at the colors. Even though we have different thicknesses of these crystal veneers, the laboratory did a great job in terms of modulating, you know, the opacity needed. So I could go in with one cement, and this was Variolink veneer as a cement, the high value. One cement was my one-stop shop, and all of a sudden, seating the case really does not take very long. Finishing will take it a little bit longer. And you've got to go ahead and do all these margins here and take all these margins down, just as we've described, to make sure that you have got a nice case. Here you see this patient now right at finishing. And what you see is we've eliminated all the shoulders, and this is starting to look great and really start to be defined. But you see how beautiful these Aurum Ceramic crystal veneers really are. I mean, you see how beautiful they are. They're not too opaque. They've got some nice colorization in them. They look lifelike, and they're certainly nice and white. That's what the patient wanted, but they are certainly not too bulky at all. I mean, they are beautiful in terms of the contours, and look at that beautiful smiling face. I mean, when you put them side by side, it's a different person. I mean, it's really a different person when you go ahead and look at this. So, you know, these crystal veneers, minimal prep. This patient did not have any anesthetic. They did not have any temporaries. It's incredible what you can accomplish just with some simple, easy techniques and procedures from the dentist's point of view, and a laboratory like Aurum Ceramics that really knows what they're doing with these crystal veneers here. Let me show you this case here too. I mean, this is an interesting case. This is the pre-op case of a patient. She brought him with her. She wanted some veneers. She wanted a little bit longer teeth, but she wanted whiter teeth there as well. She had a popular minimal prep system that's out on the market, and these are the veneers that she had afterwards. She came to us. She wasn't really happy with the result. This has been the biggest complaint, even from the patient side. They're too opaque. They're too bulky. She didn't like the bulkiness of the cuspids. She didn't like the contours of a lot of the teeth. And she's not an exceptionally picky patient, but they also did not look lifelike to her. I mean, they looked kind of dead. They looked way too opaque.